Etiology of leukemia. Leukemia or the blood cancer. It is a disease in which there is overproduction of immature and the abnormal blood cells. That is the lymphocyte, RBC, platelets and the WBC. These are harmful and useless. And these abnormal cells, they produces and pressure over the tissue producing the normal blood cells, and they destroy them by their particular chemicals secreted by these cancer cells. The etiology is unknown, but it is traditionally divided into two types, that is genetic predisposition, in which there is abnormal genes are produced within the body of the patient, and these are inherited. Secondly, there is environmental factors, which includes risk factors, the exposure to radiations, exposure especially to the X-rays, radiation. Next is the surgical trauma, physical trauma, and the exposure to the smoking chemicals. Cigarette smoke consists of thousands of the chemicals which are injurious, and that produces these changes in the blood producing tissues, that is the lymphoid and the myeloid tissue. Lymphoid tissues, they are present in the lymphatic nodes, spleen and the other sites of production of the lymphocytes. Whereas the myeloid cells, they are produced within the bone marrow. So there are two types of leukemia, that is lymphatic and the myeloid. And according to speed of progression, it is divided into two categories, that is acute and the chronic one. Mostly the young children, they suffer from the lymphatic leukemia, whereas the adults, they suffer from the myeloid leukemia. Acute leukemia is dangerous because it is very rapid in onset. The symptom appears evident and the earlier one. Whereas chronic is insidious for a long period, and the symptoms may appear after months or years. So we have to proceed towards the investigation for early diagnosis of the leukemia. For that, we perform CBC. By this test in the laboratory, the circulating cells, the leukemic cells, they are identified by the CBC test. There is abnormal circulation of the leukemia and the leukemic cells, that is lymphocyte, RBC, platelets and the WBC. So these are in abundant quantity, excessively produced in abnormal form at the different stages, which are useless ones and the harmful to the patient one. So there is deficiency of production of normal lymphatic lymphocytes and the myeloid cell, that is RBC and WBC and platelets. And due to these deficiencies, the symptoms appears in the patient, which are very dangerous ones, as the normal function of the tissues, the myeloid and the lymphatic, that is the reduced one. So there is weakness in the immunity of the patient. The patient suffers various diseases due to weak immunity. Next is that is the biopsy of the bone marrow and the lymphatic tissue. So the small pieces from the suspected bones and the lymphoid collection we send to the lab for the microscopic investigation and study of the abnormal cells in the lab. So these are the biopsy, the lymphoid and the myeloid tissues. They are studied under the microscope. Now the methods of treatment. They are traditional one, as there is no use of the application of the surgical manipulation, because it is a circulating cancer. These cells, the blood cancer, they consist of the cells. They are circulating throughout the body organs through the blood stream. So we cannot use any surgical manipulation. Traditional chemotherapy, which consists of a single drug or the combination of the drugs which destroy and kill these cancer cells in the myeloid tissue and the lymphatic tissue. So these are drugs, but they can produce harm in the surrounding normal tissues. So now we prefer into the targeted therapy. It consists of the drugs which are absolutely attacking only the DNA of the cancer cells in the myeloid tissue and the lymphoid tissue. So these are specific drugs which are only harmful and produces the changes in the DNA of the cancer cells, and the surrounding normal tissue or functioning normal tissue, they are escaped one. So there is no side effect of these medicine. All these medicine, they are given orally or through the IV routes. Next is the immunotherapy. In this method of treatment, we use the various medicines which enhance and potentiate and invigorate the potency and the capacity of the human immunity, that is immune cells, T cell, B cell and the plasma cells, to attack and destroy the cancer cells in the myeloid tissue and the lymphoid tissue. These medicines, they have no direct action over the cancer cells, but these destroy the material which is produced by the cancer cell, and that produces a particular wall around the safety wall around the cancer cell, and the normal immune cells of the body cannot approach and get access to the cancer location, and they cannot identify the exact location of the disease. So these medicines, they destroy that wall and guide the immune system, T cell, B cell, plasma cells, to approach direct to the cancer location and destroy and attack. This is a normal process of the human body by the immune system to attack the foreign body. So these medicines are very beneficial one and mostly used one by one according to severity and stages of the cancer cells. Now last, and which is very scientific and the modern research, that is called as bone marrow transplantation. In these stem cells, which are pluripotent and normally present in human being in the iliac bone, iris and the subcutaneous fat, that can be obtained from the patient himself, and they are injected through the bloodstream, and that goes to the location of the diseased one, that is where the cancer cells, they are being produced in the bone marrow and in the lymphoid tissues. These stem cells, they are seeded through bloodstream into the location of cancer, and they destroy the cancer cells and produces the normal cells, because the DNA of these stem cells, they are can be converted into the normal DNA of the organs where these are embedded or where they are seeded one. So these cells, they start producing normal tissues, which produces the normal function of the RBC, WBC, platelets, and the lymphocytes. So these stem cell therapy is a current therapy which is used nowadays in almost all the developed countries and even in the developing countries one, and these are very beneficial, and the remarkable results are obtained by this stem cell therapy.